Brunswick, Greg McCollum, our director of the Emergency Measures Organization, is our point person with the military in relation to how logistics will work. Secondly, we're aware of limited doses that will be available in December, but very limited, not really to a point where anyone is going to have any great vaccine rollout, but basically just the logistics of being able to manage, and I would say most particularly the Pfizer vaccine that requires the minus 75 degrees for storage. So that is all that'll be learned through December, and the rollout that we are planning for is actually what will take place in the first quarter of this year, where we've been told directly that we should have about 60,000 units that we will be able to set up and actually vaccine in a looking at a priority basis, and we'll work with public health on what the priorities should look like. But the important part of all of that is what will be the schedule of delivery. Do we get the 60,000 vaccines all at once? Are they spread out over the first quarter? What's the timing going to look like? So for me, it's I need the timing of delivery so we can plan the logistics. And we feel very confident, whether we are working with the military or using our own resources that have delivered vaccines, for forever in our province. We feel confident we can manage the logistics of it all. But we're pleased with the backup resources that the federal government and the military have offered.
So it is a dry run for us to ensure that all the measures are in place logistically. We do have Greg McCollum now is in charge of the logistics for the vaccine rollout, which is great. He has a military background. I actually have worked with him before in the military, and obviously he has a long history here in New Brunswick of leading us through many emergencies, whether it be a flood or other situations like that. So we have everything in place that we need from a planning perspective. It's a matter of then operationalizing it and make sure that what's on paper is actually smoothly rolled out in reality. As of right now, we do have some preliminary plans in place, but I don't think that we're at the point where we want to share them publicly. There are many, many security issues around the logistics pieces. We have heard internationally of some challenges with hackers in terms of the transport of the cold chain and protection of the cold chain of the vaccines, but I will turn it over to the Premier to add anything to that.
I don't think there's much I can add to that. I believe the federal government acquired 26 actual freezers. I think that this trial run is, to me, it seems like a lot more related to Pfizer's product and the concern of how it's going to be handled and managed, because it is unique to the other vaccines in that regard. There are 7 vaccines to get all together. The federal government has assured us they have certainly acquired multiple doses, millions of doses of at least with 4 different suppliers. So I don't think that vaccine supply will be a problem. I think initially it's kind of figuring out the timelines and the priorities. But I think this dry run is basically Pfizer wants to ensure the public and the government that they can actually be able to manage the distribution of their product, because and they're directly involved with it, which is I'm not sure if the others are in that sense.